Hi everybody, happy rainy Tuesday afternoon. I just wanted to come on here and show you guys what I've been doing today to raise awareness about pulmonary fibrosis. This morning I spent the morning time going around to family care practices in Anderson to give them a packet of information that the education nurse with Bowring or Ingelheim helped me put together to distribute. The information in it is about progressive fibrosing interstitial lung disease. This specific packet is for rheumatologists, but I did have a packet for family practice physicians. And then this is a fold out talking about autoimmune ILD fast facts, know who is at risk for ILD, and it goes through like rheumatoid arthritis, systemic sclerosis, connective tissue disease. And then this has one of those, I don't know, interesting things where you can feel, and it's about, could their lungs be turning to stone? And it shows normal lungs and then fibrotic lungs. There is a ILD family tree that goes through and shows the ILDs and the going down through there, how it could be related to ILD. And then this is a pullout, and it shows normal lungs, and then fibrotic lungs, and then some facts on there. And then of course we included a handout to let everyone know we are available at AMED Pulmonary Sleep Medicine for anything that they need related to patients that they have that may have pulmonary fibrosis. They are welcome to reach out to us. This is very important because with the incidences of COVID, it can raise people's chances of having pulmonary fibrosis, because we are seeing that. It could also lead to pulmonary hypertension due to interstitial lung disease. I have a friend, and I've told this story, or I relayed it on Facebook recently. She's a respiratory therapist that used to work here at AMED, and her husband was diagnosed with COVID, and he was on ventilator and was pretty sick, and he'd been doing okay for a couple of years. And unfortunately, over the last 6 months to a year, I'm not exactly sure the time frame, he was diagnosed with pulmonary fibrosis, and he is now at Duke awaiting a lung transplant because his pulmonary fibrosis unfortunately declined. But he is fortunate enough to be on the Duke transplant list. But it is a commitment and a process for not just him, but the whole family. And so they are there now waiting, and he's got to go through, I believe, pulmonary rehab and some other things. So, but he's fortunate enough to be included on transplant. The only thing that wasn't included in this list, in this brochure or packet that I have, is this right here. And it is the sound that can help diagnose pulmonary fibrosis. That is the sound of Velcro pulling apart. And that is the sound that patients with pulmonary fibrosis, that's the sound their lungs, that the doctor can hear their lungs in the bases. Sounds like Velcro. Sorry, a little ASMR. But anyway, just wanted to let you know that it's very important to be aware of what the symptoms are, which is usually a fast onset cough, persistent, that's not going away, fatigue, shortness of breath, or unexplained shortness of breath, unexplained fatigue with minimal exertion. So just so you're aware, because you could have been exposed to something that you're not aware of for a long period of time that could possibly cause pulmonary fibrosis. We just had the 9/11 anniversary, and people who were up there in New York at that time who had nothing, who weren't in the Twin Towers, who could have just been close by, or just been in that in the way of the dust particles when the buildings fell. They could have been exposed to something that could cause them to have pulmonary fibrosis. That increases the incidences of it. People who worked the site, they could have been exposed to something that could create pulmonary fibrosis, because unfortunately it is true. You can have pulmonary fibrosis due to occupational exposures, recreational exposures. We have a lot of farmers here in South Carolina, in the upstate, and they are at high risk for pulmonary fibrosis due to possibly what's in the soil or chemicals that they work with. So it's just something to know. COVID can increase it, exposures due to occupation or just something you may enjoy, a hobby or something. You just have to be aware. So that's why it's important to know what the symptoms are and to be an advocate for yourself and to address it. And AMED Pulmonary Sleep Medicine, the physicians, the nurse practitioners are there. They are there to help in any way they can for you, or if talk to your physician if you have any issues. So I hope this helps someone, and hope you know that we are really serious about raising awareness for pulmonary fibrosis. Y'all have a good night.